Hey, this is Lisa. I'm going to talk with you about the importance of making sure the lab specimens are labeled properly before they're sent down to the lab. There's many issues that can come from the wrong patient information being on the vial of blood or urine or anything that is sent down to the lab. It can lead to improper treatment of the patient. Maybe somebody's getting antibiotics when they don't need them, and somebody else is getting worse when they really have to have antibiotics because they didn't have the right lab sent down. It could be the blood transfusion being the incompatible match because of the wrong blood labeled. The patient can end up with multiple blood draws trying to figure out what's really going on. The effects can range anywhere from just the patient being generally unhappy to potentially death, depending on how severe the situation in the case may be, how much of it actually reached the patient and how much was caught before it got to the point of the patient having any kind of adverse effect from it. On the nursing end, specifically, they're looking at corrective actions. Now, if it becomes a pattern that you're not checking the proper information on the patient before this is being sent down to the lab. It's been a problem for years. It's not like it's anything new. It's just really hard to find a solution that's consistent throughout all forms of nursing. Every different unit of the hospital, every doctor's office, there's just no way to keep it all very consistent. It's such an issue that in 2015, the Joint Commission made it a patient safety goal that there has to be a two-patient identifier with all lab specimens. That's the patient's name and date of birth. And it has to be labeled at the patient's bedside in front of the patient. That way, you have a less chance of having the wrong label, the wrong information going on that specimen before it gets down to the lab. My idea to try to fix this is to not only label it in front of the patient, but have the patient physically look at the label as well to make sure and to just have that visual that they have the right information on that lab specimen. If in the event the patient's not able to answer that question or to verify any information, maybe they're confused or they're not even awake at all, then you would have a family member verify that information if they're available, if not another staff member, and then have that staff member initial on the label, just as safeguarding to make sure that it's all correct. The trial that I would be conducting would be done in the adult cardiac step-down unit, and it is a teaching hospital, so it's expected of the patients coming in to have different things done to try to better their care. It would include all patients on the unit. There are 25 patient beds on the unit. Generally, they're all occupied. Any new admissions would be educated upon their arrival of this trial that we're doing. All the current patients would be educated by the bedside nurse on the beginning of this trial, just so that way they don't think that there's anything that had happened to their specific lab specimen and start to worry unnecessarily. Our charge nurse usually goes around and helps with our admissions, so they would be the ones we would recruit to really educate the new admissions on this practice that we're attempting to do. I would send out an email to all the staff explaining why I think this is going to be helpful, why I want to do it, and just ask for their cooperation. I would have this trial go over about a 2-month span. That way we can get a decently clear picture about if this is working, if it's something that we still need to look at further. I would try to get the lab also to send me a report of any mislabeled labs that had gone through in the last 2 months prior to starting this. That way we had a comparison, and then have them send weekly updates as this trial goes on to see if there's any improvement over the course of the 2 months with having that visual verification of patient identification. I feel like including the patient in this process is going to make them feel a lot more involved in their care. It's going to give them more hands-on, more control over what's going on. Whereas if you come back and say that you had to draw the lab again because it was there was a mistake with it, they're going to wonder if they could have done anything to help prevent that mistake. And this is something that's very easy that they can do. It doesn't take any time away from them. It doesn't add any more time onto the nurse's day, just to have them look at that label on that specimen before it's sent down to verify that it's their information and that it's all correct. There's been even times that the information on the label itself isn't correct from where they're admitted. Their name and birthday may be the same, but their medical record number or their CSN, the number that stays with them through every admission, could have an error with it. I've had patients where their birth dates were wrong and all the lab work didn't upload correctly. Even though it was the right patient, it was still the wrong information on the label, which if the patient would have looked at that, they would have seen that there was something wrong. The study would end up being a qualitative study because there's dependent and independent variables involved. The dependent variable would be the number of mislabeled specimens that were received prior to starting this trial. And I'm not sure. I've never looked at the numbers personally at this point. If there's a trend at that time of year, like when new staff comes in, maybe holidays, if their records show that the unit was short-staffed at the time, I don't know if there's a trend with that. But the independent variable would be the new visual verification of patient identification that would be done at the bedside. And we would see if that would make any kind of difference at all. I feel in the end, if this works and goes beyond just our unit and goes hospital-wide, that it's going to greatly reduce the amount of specimens being sent to the lab with the wrong patient information, that the patient satisfaction scores are going to go higher, the length of stay is going to be shorter, they're going to have better patient outcomes in general because they're being treated for the proper illness in a faster time frame than trying to do the guessing game as if the lab work really belongs to them, if it's somebody else getting sicker because they aren't getting treated properly. There's a lot of things that can play into something as simple as the wrong label on the wrong tube of blood being sent to the lab. There's no way for the lab to determine otherwise that blood belongs to that patient or not. The only time I've ever gotten a call from the lab questioning is if they didn't have an order for whatever was sent down. And a lot of times it's because I forgot on my end to acknowledge the order for the lab to see it. Otherwise, they don't know any other. If everybody on the floor is ordered a CBC every day, there's no way for them to determine that blood belongs to the patient it says it does other than the label on it. Sometimes the doctors can pick up and question, or the nurse can pick up and question if there's a major range from one blood draw to the next of the same lab. Sometimes there could be something going on with the patient that it's completely overlooked and they're treated and they end up getting worse, and there's no way to determine what it was, whether it was the wrong lab or if they truly are that sick. It's just better overall to have the definite knowing that it's the right information. There's been multiple things that we've tried on our unit, specifically in the past, to reduce the amount of mislabeled labs being sent. One of the things that we did was had our unit uses Optio labels that has the patient's barcode, name, birth date, medical record number, everything printed on those labs, and you take that sticker and you put it on the lab work and send it down. They're generally kept at the front desk in a binder under each patient's room number. What nurses were doing were either labeling the labs before they went in or drawing the blood coming out and then putting the labels on at the desk, which is completely against the Joint Commission's recommendations. So we had taken sheets of these labels and put them in the patient's room. That way the labels were already in there. There was no grabbing the wrong label. There was no confusion. It worked for a little while, and then their issue came up that the labels weren't being taken out of the room from the prior patient. So the nurse wasn't paying attention to the name, just assumed because it was in there, it was the right patient, was putting labels on, sending them down, and they were running on a patient that wasn't even admitted in the hospital anymore. So that didn't work very well at all. We have tried having the Optio labels in the pull down right outside the patient's room where the medications are kept, and that had the same result. It worked for a little while at first, but then came into the same issue of the labels not being removed when the patient was no longer in that room. We have educated the nurses as much as possible on the importance of making sure the labs are labeled properly, the proper way to do it, that they're to be labeled at the bedside, that there needs to be the name and date of birth verified verbally with the patient, I don't know if this is just not getting done, if the patient's not paying attention to the nurse when they're saying this. I'm really not sure where the breakdown ended up being in that, but it's not being done properly, which is why there's still such an issue with specimens being mislabeled. So I feel like if everybody would cooperate with this and be on board with this trial, at least in the short term, until we see if there's success with it, I think it's going to make a huge difference as far as the patient's outcome and their stay, and everything is going to work a lot smoother because we're going to have the proper information that's needed. Thank you.